So let's briefly talk about NEOS, which is a phase 2 trial of neoadjuvant osimertinib for surgically resected EGFR mutated non-small cell lung cancer. So we're talking about neoadjuvant, which means giving osimertinib even before you go to surgery. At Dora, I told you that we were giving osimertinib after surgery. So this is looking at osimertinib before surgery. So I just tried to cut to the meat here. And basically, this was a multi-institutional phase 2 study looking at neoadjuvant osimertinib for patients with surgically resectable stage 1 to stage 3A disease. Unfortunately, this study did not meet the primary endpoint of major pathologic response in 50% of the patients. You're probably wondering, well, what is major pathologic response? You probably hear this term, and some of you may know, but I always need a refresher. And it means that when you take that tumor out after you get neoadjuvant chemo or neoadjuvant some kind of therapy, and you send the patient to surgery and you take that tumor out and you look under the microscope, you need to make sure that you see 10% of viable tumor or less. So if you take out that tumor and the whole thing is viable, then you have to think maybe the treatment that I got before I went to surgery didn't do a great job at killing that tumor. So a major pathologic response means that 90% of that tumor is dead. So they were really hoping to see that in the majority of patients, and unfortunately, they did not. That doesn't mean that there is no role for osimertinib, but it unfortunately was not what they wanted to see.